Good afternoon, everybody. Today I have chosen the topic of understanding x-rays. Have you ever had an x-ray before? It can be very nerve-wracking when you have to go in front of this big machine that is putting radiation into your body. But don't be discouraged. I am going to walk you through the process and put your mind at ease. Here's the first question. What is an x-ray? Well, an X-ray is an electromagnetic wave that is passed through the soft tissue of your body to capture an image. Some of the images that you can understand better when you see them on the screen is, for instance, you get a chest X-ray. So what you're seeing is black. This is the air that is put into your lungs when the image is captured. Another example would be you came into the clinic and you had injured your wrist. The doctor would want to get an x-ray to make sure there are no broken bones or fractures, and this image would show up white. The bone would be white. Another example would be a grayscale. This would come up as like any tissue or fat or muscle that's in your body. An x-ray is very quick and painless. The only reason that it would take a little bit longer is the technician having to move you in a different position, and this can cause a little bit of pain, but the x-ray itself is very painless. Why are x-rays needed? An x-ray helps a doctor to see what diagnosis he needs to use. Some examples of what you can see on an x-ray are osteoporosis, bone disease, bone cancer, any foreign objects that could be if you had a laceration, if there was any metal inside under your skin. Is an x-ray dangerous? Not too much. Did you know that if you walk outside, you're exposed to radiation on a daily basis from the UV rays from the sun? Make sure that you let the technician or your doctor know that if you are pregnant or could be pregnant. The doctor can always go a different route to get his diagnosis for whatever is going on. A doctor also likes to use an x-ray before and after surgery. For instance, you broke your bone in your leg and you have to have surgery for it to be repaired. The doctor would take an x-ray before your surgery so that way he knows where the break is at and what he has to do to fix it. And then he would take the x-ray after the surgery to make sure everything is correct and was done properly. Preparing for an x-ray, it's not all that hard. When you're on your way to get an x-ray, either leave all of your jewelry, for instance, earrings, necklaces, bracelets, any watches or anything like that, just either leave them at home or you can just leave them in your car, or for ladies, just put them in your purse. Ask the technician or the doctor whether or not you need to be fasting before an x-ray, if there is any contrast that you have to have before an x-ray. Let the technician or the doctor know if you need a translator for language barriers. Try to show up for your appointment about 15 minutes early. This will help you if you have any last-minute questions. Thank you very much for listening to my conversation on understanding x-rays. Preparing a handout for this would be very helpful for clinics. I believe that this would be material for a patient to use while they're waiting to see the doctor. Thank you very much and have a wonderful day.